Today let's talk about finger contractures. What is a finger contracture? What are the causes for a finger to contract or bend? What are the types of finger contractures? How does the finger become bent? What are the problems that can arise due to a finger contracture? What is the treatment for a finger contracture? Now, starting with what is a finger contracture? A finger contracture is a deformity of the finger in which the finger is bent forwards, that is, towards the palm. What causes a finger contracture? Finger contractures can occur because of congenital or acquired causes. Congenital meaning a deformity present by birth. Acquired means a few conditions which can cause such a deformity, like infection of the finger which heals by itself causing scarring, a burn injury or any other injury to the finger, Dupuytren's contracture, or any other surgery of the finger. Also, a finger contracture can recur, that is, it has been released in the past but the problem has recurred. What are the types of finger contractures? These can be fixed or pliable contractures. Fixed contractures result from involvement of the bone or joint structures, while in the pliable ones, the contracture is essentially in the soft tissues of the finger. How does the finger become bent? Finger contractures occur when there is tightening of one or more tissues of the finger, like skin and subcutaneous tissue or the tendon sheath, or shortening of nerves and blood vessels. Sometimes it's associated with shortening of the ligaments of the finger joints. Any involvement of any of these structures can cause shortening or bending of the finger towards the palm and inability to completely straighten it. What are the problems which can arise due to a finger contracture? The finger bends towards the palm and there is inability to completely extend or straighten the finger. In children, this will affect growth of the finger, causing retardation of growth. Deformed finger also can come in way of a hand function. Now, what is the treatment for a finger contracture? You need to assess the tight structure which causes the flexion deformity and plan the surgery accordingly. Second is releasing of contracture completely and resurfacing with new tissue. Release of the scar band or the scar contracture completely is important to remove all scar tissue. It can be done by excision or using a Z-plasty method. Resurfacing is done using flaps or tissues which are taken from adjacent fingers, like a cross finger flap or a flag flap. This procedure assures best form of treatment to prevent finger contractures and to prevent recurrences. So friends, this in short is about finger contractures. Do meet a plastic surgeon if you come across such a patient or such a case in which the finger cannot be extended completely and is bent towards the palm. Remember, release of the contracture completely is required, and to prevent recurrence of the finger contracture, one needs to apply new healthy tissue like a skin graft or a flap. Thank you so much for your hearing.